Types of cognitive behavioral therapy. Cognitive behavioral therapy, CBT, encompasses several different approaches and variations. Here are some of the most commonly practiced types of CBT. 1. Cognitive therapy, CT. Cognitive therapy, also known as cognitive restructuring, focuses on identifying and changing negative or distorted thought patterns that contribute to emotional distress. The therapist works with the individual to examine the evidence for and against their thoughts, challenge irrational beliefs, and develop more adaptive and realistic thinking patterns. The goal is to help individuals develop a more balanced and accurate perception of themselves, others, and the world. 2. Rational Emotive Behavior Therapy, REBT. REBT, developed by Albert Ellis, is a type of CBT that places significant emphasis on the role of irrational beliefs in causing emotional distress. It aims to help individuals identify and replace irrational thoughts and beliefs with more rational and constructive ones. REBT often employs active and directive techniques to challenge and dispute irrational beliefs, helping individuals develop healthier emotional responses and coping strategies. 3. Dialectical Behavior Therapy, DBT. DBT was originally developed to treat individuals with borderline personality disorder, BPD. But it has since been applied to other conditions such as self-harm, substance abuse, and eating disorders. DBT combines elements of CBT with concepts from mindfulness and acceptance-based approaches. It emphasizes the development of skills for emotion regulation, distress tolerance, interpersonal effectiveness, and mindfulness. DBT often involves both individual therapy and group skills training. 4. Acceptance and Commitment Therapy, ACT. ACT focuses on accepting and embracing one's thoughts and emotions while committing to taking actions aligned with personal values and goals. It emphasizes mindfulness and acceptance as key components of psychological well-being. ACT helps individuals develop psychological flexibility, which enables them to respond more effectively to challenging thoughts and emotions. It encourages individuals to be present in the moment, identify their values, and take committed action towards living a meaningful life. 5. Mindfulness-Based Cognitive Therapy, MBCT. MBCT combines elements of CBT with mindfulness practices. It was originally developed to prevent relapse in individuals with recurrent depression. MBCT helps individuals become more aware of their thoughts and emotions without judgment, allowing them to observe their experiences from a more detached and accepting perspective. By integrating mindfulness with cognitive restructuring techniques, MBCT aims to break the negative thought patterns that contribute to depression and promote greater well-being. 6. Multimodal Therapy. Multimodal therapy is an integrative approach to psychotherapy that was developed by psychiatrist and psychotherapist Arnold Lazarus. It combines various therapeutic techniques and interventions from different theoretical orientations to address the multiple dimensions of human functioning. The term multimodal refers to the different modalities or aspects of an individual, including behavior, affect, sensation, imagery, cognition, and interpersonal relationships. The core principle of multimodal therapy is that each individual is unique and that their difficulties arise from a combination of factors across multiple modalities. Therefore, treatment should target these various dimensions in order to achieve comprehensive and lasting change. Multimodal therapy aims to tailor interventions to the specific needs of the individual by assessing and addressing each modality. In multimodal therapy, the therapist conducts a comprehensive assessment of the individual's functioning in different modalities. This assessment may involve interviews, questionnaires, observation, and other assessment tools. Based on this assessment, the therapist collaborates with the individual to develop a personalized treatment plan that integrates techniques from various therapeutic approaches. The key modalities addressed in multimodal therapy include: A. Behavior. This modality focuses on observable actions and behavioral patterns. Techniques such as behavior modification, reinforcement, and shaping are used to promote positive behavior change. B. Affect. Affect refers to emotions and feelings. Multimodal therapy explores and addresses the individual's emotional experiences and may utilize techniques such as emotion regulation, expression, and exploration. C. Sensation. Sensation refers to physical experiences and sensations in the body. Techniques like relaxation training, sensory integration, and desensitization may be employed to address sensory issues or physical symptoms. D. Imagery. This modality involves the individual's mental imagery and visualization. Techniques such as guided imagery, visualization exercises, and mental rehearsal are used to explore and modify cognitive and emotional processes. E. Cognition. Cognition refers to thoughts, beliefs, and cognitive processes. Cognitive restructuring, cognitive reframing, and cognitive behavioral techniques may be utilized to identify and modify unhelpful thought patterns. F. Interpersonal relationships. This modality focuses on the individual's social interactions and relationships. Multimodal therapy may incorporate techniques from family therapy, couples therapy, or interpersonal skills training to address relational issues. The integration of these modalities allows multimodal therapy to provide a comprehensive and holistic approach to therapy. By addressing various dimensions of human functioning, it aims to facilitate meaningful and lasting change in the individual's well-being and functioning. It's important to note that these types of CBT are not mutually exclusive, and therapists may integrate techniques from different approaches based on the individual's needs and the specific goals of therapy. The choice of approach depends on the nature of the problem, the preferences of the individual, and the expertise of the therapist. What are the techniques used in cognitive behavioral therapy? Cognitive behavioral therapy, CBT, employs various techniques to help individuals identify and modify unhelpful thoughts, emotions, and behaviors. Here are some commonly used techniques in CBT. 1. Cognitive restructuring. This technique focuses on identifying and challenging negative or distorted thoughts and replacing them with more realistic and balanced ones. Common cognitive restructuring techniques include: A. Identifying cognitive distortions. Individuals learn to recognize common cognitive distortions such as black and white thinking, overgeneralization, and catastrophizing. By identifying these distortions, they can challenge and replace them with more accurate thoughts. B. Examining evidence. Individuals are encouraged to examine the evidence for and against their negative thoughts or beliefs. This helps them gain a more objective perspective and develop more balanced thinking. C. Alternative interpretations. Individuals learn to generate alternative explanations or interpretations of situations that are more positive or less self-critical. 2. Behavioral activation. This technique aims to increase engagement in positive and rewarding activities to improve mood and reduce symptoms of depression or anxiety. It involves: A. Activity scheduling. Individuals work with their therapist to identify and schedule enjoyable and fulfilling activities in their daily lives. By increasing pleasant and meaningful activities, individuals can experience an improvement in their mood. B. Gradual goal setting. Individuals set achievable goals and break them down into smaller, manageable steps. This helps to increase motivation and provide a sense of accomplishment. 3. Exposure therapy. This technique is commonly used to treat anxiety disorders and phobias. It involves gradually and systematically exposing individuals to feared situations or objects in a controlled and safe manner. Exposure therapy techniques include: A. Systematic desensitization. Individuals learn relaxation techniques and then gradually expose themselves to anxiety-provoking situations or stimuli while practicing relaxation. This helps to reduce the fear response and build tolerance. B. In vivo exposure. Individuals directly confront feared situations or stimuli in real-life settings. The exposure is typically conducted gradually, starting with less anxiety-provoking situations and progressing to more challenging ones. C. Problem-solving skills. This technique helps individuals develop effective problem-solving strategies to cope with life stressors. It involves: D. Defining the problem. Individuals learn to identify and define the specific problem they are facing. E. Generating solutions. Individuals brainstorm potential solutions and evaluate their pros and cons. F. Selecting and implementing solutions. Individuals choose the most appropriate solution and develop a plan of action to address the problem. G. Evaluating outcomes. Individuals assess the effectiveness of their chosen solution and make adjustments as needed. H. Thought records. Thought records are worksheets used to track and examine thoughts, emotions, and associated behaviors in specific situations. Individuals learn to identify and challenge negative or unhelpful thoughts, providing an opportunity for cognitive restructuring. 4. Relaxation and stress reduction techniques. These techniques aim to reduce physiological and psychological symptoms of stress and anxiety. Common techniques include deep breathing exercises, progressive muscle relaxation, guided imagery, and mindfulness meditation. It's important to note that the specific techniques used in CBT may vary depending on the individual's needs, the nature of the problem, and the therapist's approach. The therapist tailors the treatment plan and techniques to suit the individual's unique circumstances.